have Jessica Monahan. Please correct me if that is wrong, Jessica.
That was perfect.
Thank you. I'm glad to hear that. Jessica Monahan, PhD, is a neurodivergent researcher for Spectrum Scholars, a comprehensive college to career program for autistic undergrads at the University of Delaware. She has a PhD in educational psychology from the University of Connecticut, and holds a secondary appointment as an assistant professor in the School of Education at UD. Jessica, welcome to the conversation.
Thank you. I'm excited to be here.
Yes, looking forward to hearing from you about understanding autistic college students' mental health.
All right. I'm going to share my screen if that's okay.
Yes, please go ahead.
All right. And then I'll do the very typical, can everybody see it?
Can see it from here.
Wonderful. Okay, I'm going to set a timer for myself. And I am also very self-aware that sometimes I speak very quickly, thanks to my brain working much faster than is typically helpful for people. So if I need to slow down at all, please feel free. Like if people are saying in the chat, hey, you're going too fast, unmute and yell at me. I am open for all of that.
As a fellow, yeah.
Oh, go ahead.
Thumbs up if it's going.
Perfect. All right, great. So I'm really excited to be here. I loved Claire's talk, and I think it lends itself really well to the types of messages that my students at the University of Delaware have been trying to communicate with me. So I was really excited to hear, especially the Q&A. I think it's a wonderful segue. So I'm going to be talking about autistic college students and their mental health. And I recognize that I am over in the States. So I'm going to say college, post-secondary education, higher education. That's all the tertiary settings. It's just my brain is going to default to the words that I use. And I think one other important point is that all of the information I'm going to talk about today is coming from the US setting. And we tend to be behind other parts of the world when we think about neurodiversity, specifically autistic students in higher education. So there may be things that I talk about that in your experiences, you're like, well, yeah, duh, Jess, we're doing that, but maybe not. So I just want to put that context out there to make sure that we kind of all recognize that that's what's happening. So I have a general sense of what I'm hoping to do. I'll introduce myself. I'd love to hear who is in the audience. So if you wouldn't mind taking a moment, I'll prompt you again in the chat to just kind of put what's your role, so I know what to kind of target the examples and things that I use. That will be really helpful. I'm going to give you a little bit of a background about why we did the study we did. I'll introduce the study to you, and I will not be focusing on methods because most people find those incredibly boring. And the exciting thing is what our students said about the results. So I'll tell you a little bit about the study, share with you the results of the study. And then the most exciting part, I think, is that we took all of our results to an autistic advisory board of autistic college students on our campus and said, we have this data, now what? And they helped us make sense of it and provide recommendations. And so that's where the kind of crux of the conversation will be. Okay, so I'm going to introduce, so who's in the audience? There's your prompt. So I see OT, neuropsych. Okay, registered nurse. Oh, the struggle is, yes, no, I feel that. Okay.
Printing, yeah.
Oh yeah. All right, this is all really exciting. Okay. All right, perfect.
Yeah.
Thank you for doing that. This is a great bunch. Okay. So I'm going to tell you very briefly about myself because I think it helps with the context. I'm a neurodivergent researcher. I was diagnosed with ADHD in 2021. In our program, I work at the University of Delaware, which is the second smallest state in the US. When I got the job at UD, I had to like look on a map to see where Delaware was because over here, no one knows where Delaware is. I barely know, and I live here. So we have an autism support program. We have autistic employees that are part of our staff. And one of the autistic employees, we became very good friends. And he said to me, I don't want you to take offense to this, but you are autistic. And I was like, oh, I don't take offense to that at all. I've never thought about this before. Maybe I should go explore this idea. And the pandemic hit, and all of my anxiety, because I've had an anxiety disorder my whole life, all of the anxiety just melted away when I stayed at home and controlled my own environment. And so I went after an evaluation, and I have ADHD, like raging ADHD, which contributed to many of my mental health concerns. And my friend is still adamant that it's not the correct diagnosis. I don't know. I am neurodivergent. My brain does not work in a typical way. My brain is wonderful. So that gives you a little bit of context of who I am. The kinds of research that I do, though, so I'm situated in this program. I don't come up with my research studies because I'm not an autistic college student. I don't know what the problems are. So I work closely with our students, and we do the studies that they want to have done. And so right now our focus is on mental health, which is not probably surprising to anybody on this call. And I recently have a student who just submitted her IRB, which is our ethics board, for a study on disclosure. So in the fall, we're going to be launching a study that looks at what are the factors related to autistic disclosure in higher ed. So that's kind of a little bit of a background about me. There is a large research team connected to this project that did a lot of the really hard work, especially Vinny down here at Kennedy Krieger. She did all of our analyses. So I always like to make sure that they are acknowledged. Okay, so we're going to jump into a little bit of background. I think this call it's pretty clear that people are comfortable with both identity and person first. I typically will use identity first language because that's what my students prefer. But I like to put that disclaimer out there before I really jump into things. Okay, also we all know what autism is, but I like to include this slide because I'm trying to use less of the DSM-5 definition and get other people used to seeing definitions that are not from the DSM-5, which is what we use in the US for a medical diagnosis. So this is from Dr. Nick Walker. She is a scientist. She's an autistic advocate. This is how she describes or defines autism: being a genetically based human neurological variant, right? So this idea of neurodiversity, we are all very well aware of this. I'm not going to harp on it at all. I really like this idea of a different neurological operating system. So my 10-year-old is autistic. He allows me to disclose that to people when I'm presenting or talking about autism because he's very proud of his identity. And he this is the this description of autism that really resonates for him is like this, oh, I have a different kind of computer. It does different things. And sometimes the world around me is not okay with my computer, and that can be hard. So I encourage anybody who's looking to have a different definition of autism that's not based on medical model to check out Nick Walker, and the reference is at the end of the presentation, which I can send out after. So when we think about college, and this is data from the US, so that's important to remember again. We know that even pre-pandemic, mental health issues were increasing in college students. It's been a problem for a really long time. It's a good problem to have in that it means that all of the campaigning for making mental health a more common thing to talk about, it means it's working in the US. Students are really open to talking about mental health. What that has done is that has inundated the college counseling centers that are on college campuses. So I just met with our college counseling center a couple of weeks ago, and I should put out here that I'm going to talk about things that could potentially be triggering. So suicidal ideation, trauma, all of this is going to come up in this presentation. I have trigger warnings before the trauma slides, so you can mute me and ignore me for a couple minutes when that happens. But he said that, you know, he's been working in this field for 20 years, and with the general population, students in college, it used to take 6 to 8 weeks for a student to admit that they were having thoughts of self-harm or suicidal ideation. And he said now there's such little stigma around mental health in the college setting that students will come to the college counseling center and just tell the admin assistant or the receptionist, I'm having suicidal thoughts. And so that's amazing. And what's happening is that they're really feeling inundated. Of course, we all know that COVID has made this problem significantly worse, especially among the autistic population. And so what's happened is college counseling centers have gone to the short-term counseling, like six, 7 sessions at most, and then saying, we can try and help you find a community support, but we can't help you anymore. We have this extensive wait list. So when you think about this in the context of autistic college students, we know that they want more mental health support, specifically from experienced providers. And at UD, we do a needs assessment for autistic students every couple of years. We did one in 2019, and we're wrapping up the analysis of the one we did in 2023, and the message is still the same. They want more mental health support from people who know autism. And in the research, we know that there is a lack of mental health providers who genuinely understand the autistic population. That's why I'm so excited for, you know, conferences like this, where I'm learning, everyone's learning, and we're building capacity to support people. And we also know that the needs of autistic students are very different than the needs of non-autistic students when it comes to mental health. I mean, not every need is different, right? There's lots and lots of overlap, but there are unique things related to sensory considerations, different types of trauma that non-autistic students don't experience that autistic college students do. And we know that autistic young adults take more therapy sessions to reach their therapeutic goals than people who are non-autistic. So when we think about this idea that college counseling centers are stopping this long-term commitment to students, and we know that autistic students need more therapy, it's not great. Things aren't looking good. We also know that there is a really big problem in autism research, although in the last 5 years, it has gotten so much better. People were doing participatory research prior to 5 years ago, but 5-ish years ago is when we started seeing this explosion of participatory research in higher education, which is amazing. So we know that autistic voice is important when we are planning studies, doing the studies, disseminating our information, because many times studies are funded that have no tangible benefit to autistic people, and autistic people keep telling us this. So it was really important for us to include students in the process of this study. Specifically, what we focused on was, okay, we did this analysis, because you'll see all of the data already existed. Now what? Because that's what is important at the end of the day. So our study, what we did is we did a secondary analysis. So all of the data already existed from this center called the Center for Collegiate Mental Health. It's run out of, I think it's Penn State University, because there's also no, it was Penn State. I get them confused. So we did a secondary analysis of data from CCMH. And what CCMH does is it's a network of over 700 colleges and universities in the US who provide counseling data to Penn State, and it's available for anybody to analyze. And so you have to submit a proposal and say, this is why I'd like to analyze your data. Here are my research questions, all of that. So we said, wait a minute. Measuring anything with autistic college students in higher ed is incredibly difficult because there's not a lot of people who will openly identify as autistic, and it's very difficult to find these students. So this study has data from 3 different academic years because they began finally asking students, are you autistic? And so we were able to pull that data and answer our questions. So the data comes from this measure called the CCAP 62. It is wildly common in the US. I'm not sure if it's used in other higher education settings internationally, but it's called the Counseling Center Assessment of Psychological Symptoms. And it is typically used as, I don't know if you can see my dog, but he wants you to know he's here and he's clicking on my buttons. We're going to stay right here, Georgie. Okay. So it's pretty much used as an intake. So a student will come into the counseling center, they will take the CCAP 62, and they'll get scores on all of these constructs in the middle column that will help the college counseling centers kind of identify where to dig in, like what's going on with this student. They can also be used as progress monitoring, all of those kinds of things. At the time that we got this data, it had a lot of studies to say, yeah, this is a great tool. It's got good properties, it's valid, it's reliable, but no one had ever looked at it with autistic students, even though we know autistic students are in these counseling centers. So the first question we wanted to know, does it work for autistic college students? And if it did, we wanted to actually look at what are the differences in mental health experiences for autistic college students compared to those with other disabilities and those with no disabilities. Because we know for young adults and adults with autism, mental health rates are much higher, but there's no actual data to show us that autistic college students have the same phenomenon. And then we wanted to know, what are some predictors of mental health for autistic college students? And so in our sample, we had just over 1,200 autistic college students, which is a pretty large number for studies in the US with higher education. The downside here is that we were not, because it was existing data, we couldn't do anything to diversify our sample. We couldn't explicitly try and reach out to centers that may have autistic college students in them that would produce less white males in our sample. So this study has the exact same problem that many studies have. Does not mean that it's okay, but it is a big limitation that we need to acknowledge right off the bat. So while the sample is high, it's important to remember that it is heavily, heavily skewed white male. Now my button won't work. Okay, so I'm not going to bore you here. This data, and I'm happy to talk about this later if people want to talk about the data, but our first question was, does this instrument work for autistic college students the same way it does for non-autistic college students? And the answer is yes, it does, which we were like, phew, because people have been using it for a while. So glad to see that it's actually measuring the same types of things with the same efficacy that it does for non-autistic students. So that was great. Then we wanted to really understand, okay, now we know this tool works the same way. What are we seeing? When students come to college counseling centers, that's the other caveat here, this is not students who are, this is only students who are accessing mental health support. So it leaves a good chunk of students out of this sample. But for those who are coming to college counseling centers, are their concerns the same? Are they different than students with other disabilities and students with no disabilities? And so what we found, I have the visual graphic here, but I also have everything highlighted in text on the right-hand side of the screen. So when we looked at students, autistic students and students with no disabilities whatsoever, we found that autistic college students, and this included those with co-occurring disabilities, had higher rates of depression, anxiety, family distress, frustration, and social anxiety. This frustration and anger item used to be called hostility. And the many students raised concerns with the message that hostility kind of sent. And so they recently changed this to frustration and anger. So if you're interested in the CCAP 62 and you go look it up, I think they changed it around 3 or 4 years ago. So you might see that hostility measure, that's frustration and anger. Students had similar scores. There was no difference in their scores to students without disabilities in academic distress and eating concerns. And they actually had lower scores than students with no disabilities in substance use. So that is kind of the overall picture of students with autism versus students with no autism who are coming into college counseling centers. Higher on 5 domains, the same on 2, and lower in 1. And I'm going to talk, one of the things I'm going to talk about in a couple of slides is how our advisory board processed that information. So you'll get a little bit of insight into how our students were thinking and feeling when they saw these results. So this question got a little bit more complicated because we said, okay, well, yeah, that feels right. Having no disability is going to be very different than being autistic on a college campus. So what about students with other disabilities? And again, because this was data that we did not collect ourselves, we could not control how disabilities were categorized. Georgie, I love you so much, and I need you to not do this. I love working from home and dogs. So the way that the groups were kind of organized is we pulled out autism only. So that was around 800 students in the sample. We then pulled out autism and co-occurring disabilities because students could identify I'm autistic and I have this other disability. Then there was a group of cognitive disability only, which that is a huge number. And so we broke it down just so people could kind of understand traumatic brain injury, learning disabilities, ADHD, intellectual disabilities, and then 2 or more of those. So this group was really robust and it included a lot of different types of disabilities. Then there was a psychiatric disability only. So those were all students who had mental health related disabilities. Then there was a group of students that had the cognitive and the psychiatric, and then a smaller number that just had physical disabilities only. So what happened when we ran this analysis the first time was what you might expect. The psychiatric disability only group had numbers that were like through the roof. It was like, well, this makes sense. They have psychiatric disabilities, their access in the college counseling center because of their psychiatric disability. Okay, so we have that data, and in the paper that we're so close to being done writing, we acknowledge this. We talk about the data related to the psychiatric group and delve a little bit into it in the discussion. But ultimately, we said we're going to remove that group so we can see the autistic college students compared to everybody else, just because we felt like the fact that they were mental health disorders, it kind of conflated the data a little bit. But our goal is to be very transparent about all of this stuff. So this is a monster of a chart. So again, on the right-hand side, I have kind of a breakdown. So when we looked at the autism and co-occurring disability group and compared it to all those other disabilities, they had the highest scores on everything except for academic distress and substance use. So academic distress, again, was the same as the other groups. And again, substance use was lower. We also saw that the autism and co-occurring group and the cognitive disability group had similar scores in academic distress. And that when you looked at autism only, so the no co-occurring disability, those students had lower scores compared to autism and a co-occurring disability, except for frustration and anger and social anxiety, they were the same. So what that showed us was when you have a co-occurring disability and you're autistic, your mental health is worse. than if you just were autistic without those co-occurring things, except for frustration, anger, and social anxiety. Those scores were elevated. All right, so the next one to two slides is going to talk about trauma. So if you don't want to hear about trauma, now would be the time to mute your mic. The last thing we wanted to look at was what were the predictors of mental health for autistic college students. And so we asked a couple of students that autistic college students we work with to look at the list of variables that were available for us to look at, because again, the data already existed. And they gave us this gigantic list. Like, here are all of the things that we want tested because we think these are predictors of our mental health. And there was so much missing data in those variables that we couldn't reliably test any of them. So examples of those are financial stress, level of social support, level of family support, all of those things that we know impact somebody's mental health and the support that they have. We weren't able to test. So that was a big limitation. The two things that we were able to test were trauma. And so the trauma items were unwanted sexual contact, abusive behavior, or traumatic events. And the second variable we were able to test is sexual orientation. So probably not surprisingly, when we actually tested those, they were both predictors of mental health. So when students who experience trauma, they were more likely to have higher scores in depression, anxiety, social anxiety, eating concerns, and substance use. And those eating concerns and substance use was really important for us. They kind of like stood out because if you remember, those are two constructs that were not elevated compared to other students. They were still concerns, but they were not more concerning than non-autistic students. But when a student has trauma, they were more likely to have these eating concerns or substance use. And then a student who is non-heterosexual, and again, because of the way that the data was collected, it was heterosexual or non-heterosexual were our options. So students who are non-heterosexual were more likely to have anxiety, social anxiety, and academic distress. Okay, so we took all of this data and we brought it to our advisory board, which included 5 autistic college students. We had students of color. We had, I think 3 were students in the LGBTQ plus community. 1 student had been in college for, I think, 6 years trying to finish her degree. 1 had just recently graduated. So we had a fairly robust advisory board. So we brought these things to them. And the first thing we said after we presented was, were you surprised of any of this stuff? Did any of our results surprise you? And they looked at us and were like, no, obviously not. And when we prompted them to just talk to us a little bit more about that, the main message that we got was, in college, people are not exactly appreciative of different communication styles. And when you're autistic, you have a different communication style than a non-autistic person, and that is really difficult to navigate. Other things that came up often were sensory issues. So they said, well, yeah, when you're living in a world that is overstimulating, the RAs, the residential assistants in the dorms don't actually require people to follow quiet hours. So it's always loud. The walls are paper thin. The fluorescent lights are constantly buzzing and flickering. Yeah, no wonder our scores for frustration and anger are higher. They talked about how just processing the world around them, because it's so built for neurotypicals, is exhausting and it requires more energy. So that means they have less energy to deal with things. Many people in the neurodivergent community will talk about spoons. How many resources do you have to deal with different things that are going to come at you day to day? And sometimes you wake up and you're feeling really grounded and your mental health baseline is pretty low and you're not elevated, right? And you have a lot of spoons to deal with all of the crud that comes at you. And there are some days when you wake up and you have next to no spoons. And so something that would typically not trigger you is really, really hard. And so being autistic is just having less energy because you're dealing with the world around you. They talked a little bit about the eating concerns potentially being a sensory issue. So a couple of our students talked about how they have big time eating concerns because they have their quote unquote safe foods. But they also talked about how they know many people in college have eating concerns in general, even the general population of students. We asked specifically, why do you think frustration and anger and social anxiety scores were higher for autistic students when you compared to those with or without disabilities? And again, the same kinds of things. Being autistic is frustrating, is what one of our students said to us. They talked about having sensory issues. Same thing brought up again. Another student said, people are mean. And I was like, well, yeah, that. I hear that. This topic came up a ton, and which is why I was so excited to hear Claire talking about the social skills instruction, because that's another area that we've done a study in before. The expectation to mask and to conform to these social norms that are created by neurotypicals feels unreasonable. And so one student talked about these microaggressions that she gets that contribute to her poor mental health because she feels like she can't be her authentic self. So she says, sometimes people will say to me, you don't look or seem autistic. And she says, but what I hear them saying is, you're good at masking. Or someone will say, you socialize so well for someone with autism. And she hears people saying, well, if you were really being you, I wouldn't feel comfortable communicating with you. And so, of course, these things are contributing to their frustration and anger and their social anxiety. We asked, why do you think those who have co-occurring disabilities had, no co-occurring disabilities had better mental health than students with co-occurring disabilities? And the message was pretty clear. When you have an additional disability, those are also stressful. They come with their own problems. And they talked a little bit about how people in the world can be just weird about disability in general, specifically things like chronic illness. So then we said, okay, great. You've helped us understand the context of these results. What can we do? Because all of our work, we want to have an impact. And so we said, what would you want to see from colleges? And they said, really placing an emphasis on the validating the autistic experience. So listening to the students that are on that campus about what their experiences are in a way that produces change. So they talked a little bit about kind of tokenism and listening. Oh, I'm listening to you. These are great ideas. And then nothing happens, which is frustrating and would contribute to poor mental health. They talked about how every student with autism has different needs for stress and anxiety. So that importance of individualization. Again, more awareness of what being autistic actually means and not just the stereotypes and myths. So we have lots of media that says this is what autism is. And many autistic students are like, stop watching that. That's not what's happening here. One interesting example of this is we have, we're putting together a presentation for our faculty, and we are taking some autism stereotypes like, what's the word that I'm looking for? No one knows except for me. Diligent, detail-oriented, able to stay focused on a task until it's completed. Like all of these kind of like things that people who don't really know autism like think of when they, and it's not to say that autistic people can't do those things, but in our needs assessment that we just did, the majority of students talked about professors perceiving them as lazy, unmotivated, unengaged. And because we explicitly said, what do you want faculty to know? And they said, we're not lazy. We're not unmotivated. We're not unengaged. We are processing. We may be overwhelmed. We don't look at people directly sometimes, and that doesn't mean that we're not engaged with you. But it was just really interesting to think about how students, the things that students want faculty to know are very different than the stereotypes that many faculty come into these things with. One really big thing that I think is important to highlight is that students really, especially with the group that we have, students felt like they had to mask with their therapists. I have trouble finding therapists because I still feel like I need to mask, and I study this stuff and I know that I shouldn't be masking, but I do anyway. So they had recommendations like built-in questions at the beginning, before an intake appointment. How do you prefer to communicate? Do you have any needs when we're meeting one-on-one? Is there a specific way I can set up the room to better support you? And there's limitations to all of these things, right? Like a student might be like, yes, I would like a therapy dog in there with me. And you're like, well, I cannot bring I don't have a therapy dog, right? But acknowledging that the student may have unique needs and hearing those and doing what you can is already going to set the student up to feel like, oh, okay, I can probably be a little bit more myself with this. And that's really good. Okay. The other things, let's see, people understand autism, but they don't really know exactly. So many times training about autism is put together by neurotypicals or non-autistic people. And our students were like, could you please stop that? And on our program, what we do is we have a team. We have a neurotypical and an autistic person running trainings, which is actually what the students recommended, because they said neurotypical people don't always understand what we're trying to say. So having a team where the autistic person's leading the content and the neurotypical person can support the other neurotypical people in getting the message was important for them. Okay, so what's next? We need to be encouraging people to use the CCAPs in college autism programs across the US. We need to put better supports in place for students in the autism support programs, thinking specifically about targeted interventions for anxiety, depression, anger, frustration for autistic college students that are trauma-informed and guided by autistic students. And that is really, really important for us. And then paying special attention to students who are coming into autism support programs or disability offices who have those one or two variables that we know are predictors of mental health concerns. And then just trying to promote, like everyone here is doing, a more inclusive future and settings and experiences for autistic college students. So I'm going to just show you, the references are here if you want to explore any of that stuff. And my email's at the end. I love chatting with people, so please email me if you have 6 months down the line, you're like, maybe Jess Monahan talked about that. You can email me. But for now, I'm going to stop and have time for questions, I think, right?
Yes, thank you so much for that incredible presentation, Jess. So insightful and so informative about, I guess, what you guys as an institution at the University of Delaware have done. And I think it's really insightful the way you've then, I think it's in the second phase that you spoke about breaking down autism versus other disabilities or other comorbidities and psychiatric support needed. Quite a few questions for you, and I hope you're ready. Just jump into some of those. I'm looking through the Q&A function. For those who have put your questions in the chat, I will be trying to get to those sharply. But I think starting from the top, we have, sorry, I'm now like, where am I?
You're okay.
So we have a question from Dr. Giotti Arayamba. Apologies if I've said that wrong. And the question says, Jess, do you take self-diagnosis at this stage, or is it only after the formal diagnosis?
So the data that came from this study is a self-identification. So students would just check off the box that they were autistic. In our support support program currently at the most intense level of support, which is one-on-one sessions with a professional coach and group sessions, we have to require an autism diagnosis because of our funder. We are funded by JP Morgan Chase and Company, a large bank here, which I'm sure you've probably seen in the news, and they require an autism diagnosis. We don't like that. So what we have done is we've created what we call Tier 2 services, which are for any neurodivergent student on campus, regardless of what their neurodivergence is and whether or not they have a formal diagnosis. And we provide supports for those students.
Thank you for that. And then we have a question from Dr. David McGrath, or a comment and a question, which says, very interesting data, but can I ask if the higher rates for frustration, depression, distress, and GAD are actually statistically significant, as the rates on the bar charts are very similar to the naked eye?
Yes.
And also, say higher or lower rates generally, are these statistically significant? And will you address this in your paper?
Yes, yep, they are. We ran so for the predictors, we ran a logistical regression so it was a yes or a no, a binary response. And for AIM2, which looked at the differences, we ran a descriptive analysis using I think that an analysts use percentile scores, and we ran t-tests on them. So anytime you see something that says higher scores, those are statistically significant higher scores, or lower scores were statistically significant, and the similar was no statistical difference.
Cool. Thank you.
Yeah.
And then we have a question that says, hello, does the presenter have a POC? That's from Amber. I would like to speak with her in regards to our upcoming summit.
Oh, I don't know what a POC is, but you could definitely email me.
Amber,
so I don't have one.
Okay, Amber, I suggest if you could email Jess for that question. And then we have some great comments for you to follow through.
Awesome.
For when you get a moment.
Yes, great. Oh, a point of contact. Yeah.
Okay.
It's me. I'm my point of I am the point of contact. So you can just email me directly.
Okay.
Yeah. Thank you for clarifying that.
Cool. And then we have a question on who would evaluate the student.
In terms of the data from the study, there was no evaluation. That the students just checked the box that they were autistic. For our program, we don't do evaluation. So our students follow a cohort model. So they come in their first year of college as a group. So they're coming in from high school, from secondary. There's no rule against students who take gap years and things, but we haven't actually had anybody apply that is not straight out of high school. And all we say is show us your IEP. Which is the special education plan for high school, or if you have a recent evaluation within the last 5 or so years, we'll see that. Because we don't necessarily agree that you should have a formal diagnosis, but our hands are tied from our funder, we're pretty lax on what constitutes documentation, but we aren't doing any assessments.
Okay, thank you for that. And then, are you happy to share your slides with us?
Yes.
Yeah, okay.
Absolutely. Just, I need somebody to tell me how to do that.
Sure. I think if you could share it with the ION team or the
Perfect.
ADHD Ireland team, we'll collaborate and send it out to them.
Sounds wonderful.
Well, thank you so much.
Thank you guys
coming along and sharing all your knowledge about the work you've been doing in the States. And yeah, really appreciate and really insightful conversation we've had today.
Thank you.
Just to make the whole conference aware, we're due to be taking a 15-minute break about now. If you do have any further questions, please add them to the chat and we'll make sure they're shared with the panelists. But for now, we do have a 15-minute break before we have the formidable Sue Fletcher Watson from 4 o'clock to 4:45, coming to talk to us about principles and practices and neurodiversity informed education.